Hi, this is Jan Probst. I'm a professor in the Department of Health Services Policy and Management and director of the South Carolina Rural Health Research Center. In this lecture, I'm trying to introduce to you a little bit of what rural America is, the disparities that are experienced by rural Americans, and to some extent set the stage for Dr. Graham Adams, who will also talk about jobs that are available in rural communities. We think that this information might be useful to you in your public health career, either as you seek a job or if you are a public health professional at present, as you are looking for grant funding to help efforts to improve the lives of rural Americans. But before we get to that part, I first want you to think about things for a minute. Close your eyes, picture the entire United States of America, and think about rural. Then make a guess. How many people live in rural America? Here's the answer. There are 59 million people who live in the rural U.S. I always begin lectures with this question because I once had a graduate assistant say, "Why do we care about rural America?" Well, because it's basically as big as an entire country. If you look at this chart, you'll see that there are as many people in rural America as approximately there are in India, and far more than in countries like South Korea or Iraq. Rural America is an important place. That raises the question, when we talk about rural America, what are we talking about? There are many definitions of rural that are important because there are many government programs that specifically address health and public health in rural. Most of us would agree that New York County, New York, aka Manhattan, is not rural. Most of us would also agree that Loving County, Texas, is definitely rural. But there is rural America across the whole U.S., not just Loving County, which has 85 persons in the entire county for a population of 1/10 of one person per square mile, but there are also rural areas in New York itself. Although people who are not from the East Coast sometimes forget this, much of New York State is actually frontier county. That is, areas where the population is less than 4 people per square mile. When you get far away from the city and up into the mountains, even New York is rural. There are rural communities all across the United States. Whenever money's involved, the definition of what is rural gets to be really complicated, and the U.S. federal government has a strong interest in rural America. This is not just through the U.S. Department of Agriculture, which you could anticipate would worry about things like rural public water systems, but also many of the federal agencies structure incentives for professionals to practice in rural areas and structure payments to hospitals, physicians, and other healthcare providers based on whether they are in a rural or an urban area. So, how do they make this definition? Unfortunately for the learner, there are multiple definitions of rural. The easiest one is to say whether a whole county is rural or not. America has had counties since we were founded. They are the smallest, usually, unit of local government. They don't change very often. Their boundaries stay the same, so they're very easy to work with. You know who's in charge in a county. But as we'll talk about in a little bit, there are problems with that definition because out west, some of the counties are so big that, for example, the Grand Canyon is literally located in an urban county. The most precise definition is by census tract, which is a much smaller unit with only perhaps a few hundred or a few thousand folks in it. The problem with census tracts or with zip codes, which are a very similar size of measurement, is that these units are not constant over time and can change, but they are very precise. So what do you do within those measurements? There are, in addition, multiple levels of rural, from a term I hate, invented by, I think, the Office of Management and Budget, called micropolitan, which basically means a rural place with a little town in it, to frontier, which means rural with nobody in it. And I'm going to show you some slides that will illustrate how some of these definitions work and others don't work. As I said, counties are useful because they stay in place, they have government officials whom you can communicate with, but they can overrepresent urban. And as a classic example, let's look at California and the next map. Here's a map of the whole U.S. showing all the counties in the country. All of the white counties are urban, and ranging from a mild tan to a sort of dark brown, all of the colored counties are rural. As you would expect, America's breadbasket, all of the Great Plains states, are highly rural, very dark brown in this map. But if you'll look, I'm going to call your attention to California because this is going to illustrate a problem with counties. All of Southern California shows up as white, as does most of Arizona. And if you've ever driven through Southern California, you know that once you get about 20 miles east of San Diego, the countryside becomes increasingly rural. Counties in both of these states are very, very large. There are only 2 counties in California between the Pacific Ocean and Arizona at the San Diego level. Just 2 counties and a lot of territory. Let's see, this is why alternative measures of defining rural are sometimes used by researchers to say who's a rural population, and also used by funders to show where rural money can go. One of those shows up on our next slide. This slide illustrates California as measured by rural-urban commuting areas. This takes every census tract, looks at how many people are in it, how close it is to a major city, and assigns different grades from very, very urban to very, very rural. And as you can see in this map, California is much more varied. The western, when you live on the East Coast, you always think East Coast. The western coast by the Pacific is highly urban, as you would expect it to be if you've ever visited there. And the eastern parts of the state, while technically in urban counties, are shown to be in rural RUCAs, or rural urban commuting areas. Okay, wrapping up what we've covered in this first few minutes. First point, lots of people live in rural America, as much as in a major European nation, but spread out over a lot of geography. We also saw that rural America is present across the entire country, from places we think of as very highly urban, such as New York, through places that we know are rural, such as much of Texas. Finally, we found out that there are lots of different ways to measure rural. We're not going to bother you with that too much, but just so that you'll know that there are different ways that people can do it. If you are ever applying for a public health assistance grant, you'll have to see which definitions are being used and incorporate them into your own planning. In the next segment of this course, we'll look at some of the health disparities that exist in rural America as an example of the concept of disparities more generally.